Hello, my name is Whitney Herter, and I am a physician assistant in the Department of Surgery at the University of Colorado School of Medicine. In honor of Women's History Month, we are celebrating her story by interviewing women within our department and inviting them to share some of their experiences as women. Today, I'm talking with Dr. Elisa Birnbaum, who is a professor in the Department of Surgery. She's a colorectal surgeon, and I have had the pleasure of working with her in the Cancer Center for several years. She's shared many of her stories with me. These stories have inspired me as a woman in medicine, and I thought it would be valuable to share more. So, hi, Dr. Birnbaum. I just want you to introduce yourself. Tell us who you are, how long you've been practicing medicine, and what other things you might like to do outside of the hospital.
Hi, my name is Elisa Birnbaum. I have been a physician since 1985 when I graduated medical school, and a surgery resident from 85 to 90. I finished my fellowship in 91 in colorectal surgery, and I have been a surgical attending since 1991. I had originally planned on leaving St. Louis after my fellowship, but they offered me a job. I stayed. It was the best job in the country at the time, and really for 27 years, it was the best job that I could have ever had. And then when my children graduated high school, I moved to the University of Colorado, where I joined the faculty, and it has been wonderful here. What I like to do in my free time, well, as I have more and more free time, I like to do more and more things outdoors, gardening, skiing, riding my bike, and then indoors, reading, baking bread, making ice cream.
I love it. Can you elaborate on what made your job in St. Louis at the time the best job at the time?
Well, if you think about the year that it was, when I graduated medical school in a class of at least 200, maybe 250, there were only 2 women, myself included, that went into general surgery that I can recall. And so it was not a time where there were a lot of women in medicine. And I did my surgery residency in New York in between 1985 and 90, and the kind of the height of the AIDS epidemic, and prior to an 80-hour work week. And it was probably one of the more stressful times of my life, from just physical and mental stress, just getting through the day. And when I chose to do colorectal surgery, I chose it for a lifestyle choice. I loved, all aspects of general surgery, but for me, I wanted a job that included both inpatient and outpatient procedures, minor procedures, major procedures, the whole gamut, men and women. And colorectal surgery fit that fit that desire. And at WashU, it was a very busy program, and they allowed me to do what I wanted to do pretty much the whole time I was there. We grew a program of increasing our cancer numbers, increasing our IBD numbers, and increasing our benign anorectal pelvic floor numbers. And it was great. And then when I moved here, the aim was to grow a program primarily for pelvic floor surgery, and they have allowed me to do that, and it has been, a wonderful experience increasing the numbers and doing the operations that we do. And it's really an honor and a privilege to be able to take care of patients in this way.
Well, we're grateful for your service of our patients. I miss working with you really closely. A lot. I miss working with women in my role. So can you describe the time or like the moment or the feeling when you knew you wanted to become a surgeon? If you can remember that feeling.
Yeah, I was thinking about it. I think must have done internal medicine first, and I found it just incredibly unsatisfying because it was management of patients and doing very critical things, but the progress was really very, very slow and not visual. And I did general surgery, and I was on the service with a notoriously demanding surgeon. And they did, at the time, he did both adults and pediatric surgery. And I remember watching him sit at the bedside of a kid he did appendectomy on. Kid had appendicitis. He operated on the kid, and he sat down to talk to him post-operatively. And he sat at the side of the bed and just talked to him, the patient, as a regular person. And it was kind of at that moment that I realized that you could be a technician as well as a caring physician all around, and yet you get immediate results. So that's really where the switch came for me, where I realized that general surgery wasn't just about taking care of the surgical problem, but it was also communicating with patients.
Love it. Having a class of only potentially 2 women who applied to surgery residency in your medical school, I know you well enough to know, like, you're a confident, strong woman. That probably existed when you were in that setting too, but did that ever feel like a barrier, that there weren't other examples or
the barriers at the time were was really access. And by that I mean there was not one single person who encouraged me to go into surgery other than a gastroenterologist who, when I talked to him and told him that I was interested in going into surgery, he said, "Great field, you're going to have a rough time, but go for it." And everyone else told me that I should not apply, that I would not succeed, that I would didn't have the personality, that I didn't have the pedigree, etc., to go into surgery. And yet they were encouraging the guys in my medical school class to go in, and they had very similar backgrounds. So, yeah, those were kind of difficult access points. I did go to a general surgery residency, LIJ, which is now Winthrop in New York, and we had 4 chief residents, and it had 50%, there were 2 of us that are women, and there were 2 guys, and they were incredibly female-friendly in the program. And I think that they realized as we competed at the same level as the men, that we were and operated just as well as the men, that they were not going to ignore either me or Terry Benaquista, who was the other woman. She went into plastic surgery and is still in New York, and I opted to go into colorectal surgery partially because I was encouraged by the gastroenterologist in medical school. And I think that what we forget is that you have huge impacts on by things that you say on people's career choices.
Mm-hmm. Yeah,
and
absolutely.
So I did go back to medical school, and I did thank the gastroenterologist for being the only person who supported me.
I love that. So he was a male. Have you had female role models? I mean, in my mind, you're like the pioneer, like you are like one of the females. But did you have role models or mentors that were female, and what did you learn from them?
You know, in colorectal surgery, there were, when I got my boards, I was somewhere around the, 27th woman boarded in colorectal surgery in the country, something like that. So there were people that were nationally known at Leahy Clinic and at Minnesota, and that were women who were very supportive of the other women in colorectal surgery, so nationally. I think it was difficult, even at Washington University. There were very few women on faculty. In fact, other than a breast surgeon, I was the only other female faculty for a while. And then over time, you know, they recruited more and more women were in medical school and going through residency. And so I have a large group of friends that are women in surgery. But most of my mentors were very open to promoting women. My work colleagues were tremendous at WashU and here.
But mostly men. It sounds like the women were colleagues and
yeah,
friends.
I think it's fascinating because in colorectal surgery, when I first started, we would have a women's lunch and we had one table with all the women in colorectal surgery in the society sitting in one and then two tables at lunch. And it has now grown to be an entire huge room with, you know, multiple tables of women from medical students interested in colorectal onto senior faculty. So it's just exploded. But initially when I started, no, there were very few. And I think in my residency, having another woman who was friendly and we basically lived together for the 5 years of residency was extremely helpful.
Mm-hmm. Yeah, I feel like that kind of speaks to what we're doing, what we're trying to do in DEI is, include people so that others will come too. But clearly you've also mentored women, and so you've done your part to help grow the female side of things in colorectal surgery. Okay, so you kind of have already done this, but maybe we'll get something different out of it. Paint a picture of what it felt like entering your first years of surgical residency. What were some of the conversations that were taking place? What did that feel like?
Yeah, surgical residency in New York in 1985, if you really kind of understand the time, it was in the heart of, the peak of the AIDS epidemic. And the emergency rooms and the wards and the floors were filled with patients with a disease that was incredibly life-altering and devastating, and somewhat scary because there was no treatment for it, and so the medicine wards were completely full, and so the surgical wards were very busy taking care of surgical problems as well as problems that are normally taken care of on medicine. At the time then, it was before Libby Zion, before an 80-hour work week. We were working 100, 110 hours a week, and it was just physically and emotionally exhausting. We just did what we did. You get up, you you had to do this. And, oh, by the way, we didn't have computers. So this was all done via phone calls or paper charts or drawing blood and running down to get the slips of paper yourself with the lab values written on. And so this was just a completely chaotic time. So I think what we were just trying to do is survive and not, mess up and shine light on whether you're a woman or not. I mean, I think that became almost secondary. You just wanted to succeed and wanted to do right for your patients. So, it might have helped, because we were so overwhelmed with the volume of patients and what we were doing. It didn't really matter. It did help that I had 3 of the best co-chief residents and that I could have ever asked for. Completely different personalities, but we were completely supportive of each other and worked as a group. And that is really, I think, that is one of the reasons why we're able to succeed. I mean, there were definitely times where you just kind of wanted to go to sleep and go, I can't do this anymore. But but it was really balanced by, other people who then took over for you if you were really exhausted.
Yeah. Yeah, I feel like it's like just going through that with other people, like kind of levels the playing field.
The closest time to it is now been the past 2 years during COVID, which is, you had, especially at the beginning where you really, things were not really well understood what was going on, and, random, illnesses could be fatal, and yet you look at the residents around that were working during that time, and they worked. They got up in the morning and they worked, and they were supported by each other and and by the community around them.
Yeah, sick people too in both cases, like really sick people. Yeah.
Well, I got to say, I think I think those patients were even sicker than what I mean, watching someone die of AIDS is tragic. The ventilator and the communicable transmission of COVID, I think, made it a little bit more scary. We knew that early on, fairly quickly, that the transmission of HIV/AIDS was not from coughing and things like that, breathing next to somebody, being in a room with somebody. So I think COVID itself is, slightly different topic, but I think COVID itself is a lot scarier to certainly to lay people, but even within the medical, field.
Yeah, we didn't know that PPE was actually going to work either. That was scary.
Yeah.
Okay, this is somewhat of a personal interest question that I didn't list on there, but tell us how it felt to, I mean, not only were you like a woman, like pioneer woman surgeon, but you had 4 kids. That's not easy to do today. So can you kind of talk a little bit about what that was like?
Well, I mean, I think yes. I have 4 kids. I got pregnant during my fellowship and delivered the first couple months during my when I was an attending. And I had tremendous partners who were very supportive of that. So that made it easy. There was no concept of maternity leave at that time, certainly no concept of paternity leave. And so that was kind of early on in the kind of introduction of women in surgery. But, I mean, I only had 3 weeks of maternity leave with one of my kids, 4 weeks with one of my kids, 3 to 4. I don't know if I counted the day that I birthed her.
Yeah, right? That blows my mind. I can't, like, that was probably with your first kid too, and you're like, so there's so much with the first kid. You just don't know how to handle yourself. And then
I took 5 with him.
You did. I mean, still,
it was only going to take 4, and I added an extra week because I was still exhausted. My legs were so swollen I couldn't put shoes on.
Yeah. I can't. Yeah. 3 months didn't feel like enough. I took 5 with my last one, and I was like, wow, I am actually ready to go back. This is great. I can.
Yeah.
But she can almost feed herself.
So, I've watched on some women's Facebook sites, right? So women's surgeons Facebook site, and they're all ages in this group, and some of them are like, I'm going back at 3 months, and blah 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 blah. I'm afraid my kid's not going to remember who I am. I'm like, well, they'll want to forget who you are if you're not present in their life.
Exactly.
They're not necessarily. I mean, they do. I think there is a level of bonding, and touch and whatever, right? But I'm not sure that it's imprinted on the kids who's doing the touching for them. They just want to feel loved, right?
Exactly.
And if you're there for their life, these trying to be there for their life moments, I don't know. It's harder on you, but my kids grew up fine.
Yeah, they really all they need is love, and to be fed. All they need.
And I'm sure you have friends who they're home the moms are home 24/7, so it doesn't really matter, right?
No. Right, exactly. Yeah, that's one thing you start to learn is you don't have control over any of it. You just got to let go of control.
Yeah, you kind of don't.
Yeah,
it is what it is, but just because you're home with them doesn't mean that A, you're home with your kids, and B, that your kids are going to turn out just fine.
Yeah.
Right there.
Yeah, I mean, I feel like I had a working mom, and I feel like that was good. It was good for me to see her that way. As a female, like, good to see my mom interested and engaged in her work.
Yeah.
Yeah.
In having the kids, I was very lucky in that I was able to go through all the pregnancies without any major issues. Physically exhausting, and I think that if you talk to my residents at the time, it was also emotionally taxing, period. And I think that to make improvements in surgery, to have a better understanding of what it was like to be pregnant, I think we've made a lot of progress in that. I had no support. I had no support within the Department of Surgery. I had no support within society. Nobody really, they just expected you to have kids and not be stressed out. The job itself was stressful. Being pregnant was stressful. And I think that, it was a difficult time. And there was no one to say, hey, back off on your clinical stuff. You need to take time off. So, having said that, though, I made it through the pregnancies. My kids are graduated, and my oldest is a surgery resident. My youngest is a lawyer. I mean, they're all over the place, and they've been great. And having kids is great. I gotta say that I made every effort to try to make it to their, concerts, football games, cheerleading, events. Sometimes it was hard. Sometimes it was, I had to stop a day in the middle in order to go see these things. I certainly missed a lot of the school events when they had them in the middle of the day, in the middle of my operative schedule. You just can't stop. But my kids, I think, have a good understanding of what it's like to work. And I don't think they regret it much.
I love that. I feel like that will be interesting for them to ask about as they start to have families too.
Yeah, it would be nice, but so far none of them are having. I mean, I would like grandkids.
No pressure on them. They're like doing awesome things.
I mean, you could send this to them and ask them.
Yeah.
She wants to be a grandmother.
I'll send this to you. You can say, "Look, I did this cool interview." Yeah. I hear being a grandmother is really amazing. So, no pressure, kids. No pressure. Okay. Let's see. Two more questions. Hopefully we'll make it. Yeah. What have been your biggest career challenges and successes?
Career challenges. That's so funny. I mean, I think that I think one of my biggest career challenge was to give myself a little grace. And by that I mean there was a time when I was early in practice when I wanted to be everything. I wanted to be a great surgeon. I wanted to be a great mother. I wanted to be I was in academics, and so we had to publish and, try to come up with research projects, etc. And I realized that I couldn't do it all. And so I had to really sit down and have a conversation with myself and decide where I had to give a little. I got help with my kids, and that I had tremendous outside caregivers that helped. I had tremendous friends who helped get my kids to and from sporting events. I had, and I realized that my strength was in being a good clinician and teaching surgery and not the academics part, and I let that part, kind of slide a little bit. It's not that I wasn't involved in academics, it just wasn't my top focus because I wasn't that good at it, and I had to accept that. Was there a second part to the question? I can't remember.
Challenges and successes.
The successes. Yeah, I think the success, I mean, I'm actually pretty proud of what we have created with the pelvic floor program here. It was difficult because when I first started in practice, I wanted to do the cancers and the IBD and the diverticulitis and the laparoscopic stuff and then robotics. And when I realized that actually this area of colorectal surgery was something that I was good at doing, and we could create something that could grow exponentially, I think that's what we did. That's what I came here to do, and I'm really proud of it. We've grown this program, and hopefully it'll be kind of my legacy at the University of Colorado.
I think that will, among the many legacies, that will be one of them. That leads into that question. So the pelvic floor program is a big deal, but what other legacies do you think you will have when you're off doing all your outdoor activities in your amount of free time and
my
not
non-physical activities?
Yes.
Well, I'm not sure, right? I think that's a really hard question. I really try to work with the residents on a case-by-case basis of, just how to do things technically, how to be efficient in the operating room, how to hear about a case and figure out what is causing the problem without spinning your wheels, without ordering a gazillion tests and labs and scans. But you can really figure it out a lot of times just by thinking the process through. But I think that's a harder thing. So I think from a legacy standpoint, I think the pelvic floor, creation of a pelvic floor group and a multidiscipline approach would be kind of what I'm giving, right? The other part, it was very poignant at the end of the show ER, or when one of the characters left the emergency room and retired or was moving on, when he walked out of the emergency room and just as a new trauma was coming in, and he kept walking and the people around him kept doing it. And so, I think that you got to understand that you're just kind of you're a surgeon in a field that once you leave, that space is going to be taken up by somebody else.
Mm-hmm.
And that's not to diminish what you have done and not to diminish what you have to offer. But I think realistically, I know that when I leave, someone else will come in and do the work that I've been doing, and they may do it better. And that's great.
Yeah. Yeah, I just feel like this conversation is really amazing. I appreciate that you took the time to do this. I think other people are going to love hearing your voice and input. And I feel like, I don't know you, I mean, I've worked with you. I don't know you well on a personal level, but I feel like when you came and started working with our team, it was like a breath of fresh air. You're a woman surgeon, and you are a mother, and I think our patients always appreciate, like, you tell it like it is. Like, this is hard, and this is what we're going to do to help you. And it was just like, I always felt like really grateful that I got to even just be in your presence, witnessing kind of that interaction and watching the way you care for patients. I'd like to thank Dr. Birnbaum for sharing some of her really fascinating stories with me today. And thank you all for listening.